A PFAC, it's a funny acronym, Patient Family Advisory Council. Sounds odd for a hospice agency to include patients in that sentence, but it's an advocacy council that's aimed at representing the voices of those who receive the care we provide.
If you've worked in a healthcare system over the years, you're used to family advisory councils because they are required, but they have never been required in home care or hospice. And they are so necessary. And so when I got to Care Dimensions, I was very eager to open one of the very first PFACs in the country.
At Care Dimensions, our PFAC is made up of a group of patients, families, staff, and leaders. They help us make our organization better, and it's through their insight, their experiences, their stories, and feedback that help us guide our improvement efforts related to quality, safety, and experience.
It gives us the opportunity to collaborate with patients and families so that we can understand the care and the services we provide through their eyes, through their perspective. And I've always liked the term a fresh eyes approach. And if we don't ask the questions and if we don't listen, we need to do that to be able to understand how we can meet their expectations or better yet, surpass their expectations.
As a part of the committee itself, seeing the suggestions that we make, the feedback that we give, acted on, to see not just we're meeting to give ideas, but in the next meeting or two meetings, we're actually having, here's what's been done based upon your feedback. So Care Dimensions isn't just about hearing the opinions, they're about acting on the opinions and the feedback.
There's always ideas coming around the room, and I get very excited when people are just jumping into conversations. Many times, or most times in my experience, people are a little afraid to do that. But it seems like most of the people are willing to express their opinion, negative, positive. Let's get the conversation started, and I love that.
We've actually incorporated our PFAC members into not only review of materials after we've drafted them, but also input into things before they're built. So things like the use of technology, websites that interact with patients and families, things like being able to do a consent online. It's so important that they, as the customer, let us know how they experience that tool as opposed to how we think the tool should be used.
You know, I think that every time that we listen to a family member tell a poignant story or tell us a story about something that they wished had happened a little bit differently, I call these moments of truth. And so the phone call that was made, let's make sure that they talk to a real person, not a machine. The phone call that gets made at 3 a.m. because dad just fell out of bed and we don't know what to do. There are moments of truth for every single family, and if you try to tease those out in the storytelling, you will always learn something new that can be easily applied for other families in the future.